Hi, this is Dr. Falk, and I'm here today to talk to you about one of the latest innovations in sinus surgery. It's called balloon sinuplasty. And this is a technique that's really been borrowed from other areas of medicine, particularly the cardiac field, where balloons are used to dilate the coronary arteries and relieve obstruction. I think that this technology is somewhat of a game changer. It really has challenged the way we think about performing sinus surgery. Sinus surgery has been performed using endoscopic instruments, but even despite this intervention, the procedure can be somewhat aggressive, meaning that the way that we open sinus openings is through removing excess tissue. Well, the balloon approach is very different. Instead of cutting, pulling, or tearing tissue, we are more gradually dilating openings. In the process of dilating these openings, we are causing microfractures in the bone that surrounds the opening so that they stay permanently enlarged. The entrances of the sinuses are controlled by small ostium or openings, and these are considered the bottleneck areas to sinus drainage. When there's an obstruction at this level, whether it be due to inflammation or infection, the secondary result is for the sinus to back up. And when the sinuses back up, the mucus is retained, it pools, and then it becomes a reservoir for bacterial overgrowth. And this is our belief as to the process by which sinus infections take place. If we could dilate these sinuses, these small openings, then we would come a long way in relieving obstruction and allowing the sinuses to function more normally. The two paired sinuses that are most amenable to this type of new technology are the maxillary sinuses and the frontal sinuses. The maxillary sinus opening is located underneath a fin on the side of the nose called the middle turbinate. The frontal sinus opening is also found underneath the middle turbinate towards the superior end. So this is the Acclarent balloon sinuplasty instrument. It's an all-in-one instrument, which is something that I really like. There's a little cannula at the end of the device, and there's a little opening. The first step is we engage this device towards the level of where we believe the sinus opening would be, such as a maxillary sinus ostium. Once in position, we then use this first button to advance a guide wire. The guide wire can be controlled with this little turning, rotating wheel to help with directional placement. In a real scenario, there would be a light coming out, which helps us also further define its position and secure our safety to make sure we're in the place that we want to be. Once the guide wire is engaged, a balloon is then advanced over the guide wire. The balloon straddles the opening, as in this illustration here. When I'm satisfied with the positioning, I then dilate the balloon by turning the screw on this syringe. And when the balloon is fully dilated and it gets quite firm, it's going to cause microfractures of those openings. Those fracture patterns lead to a permanent dilation of the ostium or opening. The balloon is then deflated, and finally the whole system is withdrawn and brought out the nose. If you would like more information on balloon sinuplasty and the appropriateness of this intervention for your conditions, please give us a call.